And what's more important, if you look in Malaysia, overweight and obesity has been increasing from 2006 to 2015. And this is a real concern for us because we are one of the highest nations now. If you look into here, in Asia, published in the Lancet, that obesity in men and women is increasing in our country. This is a big concern and big challenge for the Ministry of Health Malaysia. And although the census in 2025 is predicted that in US and UK, obesity rates will be increased. But obesity is a very complex and multifaceted problem, and because it deals with society influences, individual, physical inactivities, environmental issues, biology, physiology, food consumption, food production, etc. Very complex. But how do we manage this in terms of to handle this problem? Now, the changes in dietary and physical activities patterns are often the results of environmental and societal changes associated with development and lack of supportive policies. Because if you look in Malaysia, our fast food restaurant is 24 hours, is available, and healthy food is expensive. And because of that, the public can access to food, cheap food and unhealthy food any hour of the time. So even at 3 o'clock in the morning, they still can actually have a drive-through to McDonald's and etc. So these are the challenges that we have. How can we improve in terms of to reduce the incidence of obesity? So societal level, we are looking into policies. How can we actually look into make available affordability of healthy food? And second, a food industry must come together, bringing together all the partners and to discuss with the Ministry of Health in line with the partnership and to perhaps to look into the availability of food in terms of less sugar, less fat, less salt, and etc. But enhancing meals habits, so this is what we are trying to do through framing or presentation of choice of options, whereby different ways in which choices can be presented to consumers and the impact of the presentation on consumers' decision making. Perhaps this is very indirect ways of doing it. For example, putting healthy food in glass containers and placing them prominently on a table or in refrigerator may attract more people to consume this healthy food. Secondly, using appropriate size of the plate. When you use a large plate, then you tend to pile up your food. But if you use a very small plate, then the consumer always feel deprived and basically not cost effective, and they have to come back for more serving. But more importantly, to use a diameter of 9 to 10 inches of plate, that may be helpful. Third is contrasting colors. If a plate is white, probably they'll eat more than, and is colored, probably less food, 20% less food are consumed in contrasting colors. And displaying healthier snacks option at checkout counters instead of the confectionery products. And we also realized that tidy kitchen, people were likely to snack less, 44%, in kitchen that were tidy as compared to a kitchen that is actually cluttered with papers, dirt, and etc. So this kind of behavior is important for us to adapt and to change the practice of how consumers choose their food. And altering the proximity of and the order of food is also equally important. That can influence the choice of the food, and people can encourage to make a healthier choice of food. Increasing the visibility and convenience of healthier food through front of pack labeling. For example, healthier choice, a logo, traffic light system, a guiding system. For example, they can choose. A consumer can choose their food. Calorie labeling on ready-to-serve food is also important for us, and to educate the public to have a good choice of food. So more importantly, what has been done in Malaysia is that we look into introduction of development and implementation of Malaysian dietary guidelines and Malaysian healthy plate. And whereby you look into our plate, we are going on quarter, half. Half for vegetables and fruits, quarter for cereals, and quarter for meat. So this is the concept that we try to promote, and from the school right to the public, basically to make sure that they have a selection of a proper food. And dissemination of healthy eating messages through various approaches. For example, now we're using a lot of social media, and we talk about it. and in mainstream media, and provide an environment that support a healthy living and healthy food. And more important is that when we look into the provision of healthier food and beverage product to consumers and implementing post-labeling, which helps consumer to choose healthier food, very important is self-regulating, empowering the consumers to choose healthy food and make available healthy food cheaper and affordable. This is a challenge we have in the Ministry of Health. To implement majority of food policy, I'm sure that we have a sustainable development goal. How can we do more for less? And every sector, 17 sector here, every sector is indeed a health sector. But what is more important is sector number 17. Here we are today, public and private working together as a partnership to address the issue of obesity. And hopefully with our initiative, we can bring down the cost of obesity as well as to the incidence of obesity. In Malaysia, we always tell this, a nation working together for better health towards 2050. And issues and challenges, the finite resources in need of support and commitment from other stakeholders, especially the private sector. Disagreement from food industry to implement certain policies to combat the obesity, and here we need to negotiate and probably see how we can actually work with the private sector. And health literacy, this is the most important, empowering the public towards a health-seeking behavior. Health-seeking behavior towards a healthy choice or selection of food, and lack of public understanding. At the moment, we feel that there's a lack of public understanding and commitment to take charge of their own health by eating healthily. Last but not least, this is my conclusion. We need to provide a healthy food environment and ecosystem, and what we can do indirectly, learning the behavior of the consumer, enhancing the meal habits without even them knowing it. And hopefully in time to come, in 2030, for example, if we can reduce the obesity rate and healthy living in our nation. With that, thank you for your attention.